When is IVF the ideal treatment option for you? Number one, if you have blocked fallopian tubes or damaged fallopian tubes, IVF is the best treatment option. Even for women who have undergone tubal ligation in the past and would now like to try and conceive again, IVF is a good treatment option. In the natural process, when you ovulate, the egg is released from the ovary and it travels via the tube to reach the uterus. But if the tube is damaged or blocked, the egg is not able to find its way. So when we do an IVF, we overcome this barrier by taking the egg out, fertilizing it outside the woman's body with the husband's sperm, and then putting the embryo back into the uterus. So it doesn't matter if the tube didn't exist, if it was blocked or if it was damaged, because we have bypassed that barrier. There are certain other conditions as well where IVF is a good treatment option. If the man has a low sperm count, a low motility, or a very large number of abnormal sperms, again, IVF is a good treatment option, or in very severe cases, we do what is called ICSI, because in IVF and ICSI, we need very few sperms to be able to fertilize the egg. So when you're trying to conceive naturally, you need a certain amount of sperms, but when we are doing it with IVF or ICSI, even a few sperms are enough. Now, when we come to the woman's fertility, there is something called the ovarian reserve. This is what is commonly known as a ticking biological clock. Now, when we say that we have a biological clock that is ticking, we are talking about the ovarian reserve. The ovarian reserve is the single most important determinant of the couple's chances of getting pregnant. So, when we are born, unfortunately, women are born with a fixed number of eggs. And we cannot make new eggs during our entire lifetime. To give you a perspective, women are born with about 20 lakh eggs, and by the time the girl gets her first period, this number is already reduced to about 4 lakh. So this process of the declining reserve starts right from the time of birth. So there comes a time when the ovarian reserve may already be too low for a natural pregnancy to occur, or the chances of getting pregnant naturally or with simpler treatments like IUI may simply be too low for you to keep on trying with those methods when the ovarian reserve has already started to slow down. This is what we call a biological clock ticking. As we age, fortunately, the uterus does not get as affected by age as the ovaries do. This decline in ovarian reserve is different from person to person. So one woman may have a very good reserve even into her 30s, and another woman may have a very low reserve even in her 20s. So when a woman comes to us, one of the first things we do is assess her ovarian reserve. Now, if we see that the ovarian reserve has already started reducing, then if we keep on delaying it by trying simpler treatment methods that give you lower chances of success, this decline in ovarian reserve is going to keep continuing. And if a pregnancy doesn't take place and the ovarian reserve is completely depleted, then taking donor eggs becomes the only option. So for women with a declining ovarian reserve, an IVF gives you better chances of getting pregnant soon instead of the simpler treatment options. Now, once you have reached a stage where the ovaries are almost completely depleted of eggs, unfortunately, getting pregnant with your own eggs may no longer be an option. But as I was explaining, the uterus still remains a healthy organ. So in these cases, we can take donor eggs. That is an option. We call it donor egg IVF, where the eggs are taken from a healthy young woman and then with the help of IVF or ICSI, fertilized with your husband's sperms to create embryos to put back into your uterus. So women with a completely depleted ovarian reserve who need donor eggs as well. Donor eggs, when we take donor eggs, the process has to be done with IVF. Now, there are certain other conditions where the pelvic environment may not be very healthy, and this may prevent a healthy egg from being released from the ovary and finding its way into the uterus. One of these conditions is endometriosis. When you have endometriosis, your tubes, your ovaries, your uterus, they tend to start getting stuck to each other. So even if you may undergo a surgery and release these adhesions, you may try naturally, but at times, even though the tube is now free, it's not a healthy tube and is not able to pick up the egg and transport it to the uterus. So in these cases as well, as compared to the simpler treatment options like IUI, IVF is the better treatment option because the egg will be taken out and fertilized.